Hi everyone, welcome to researchmd.com. We bring scientific evidence to you, and our presentation today is physical activity, exercise, and erectile dysfunction. Does it help? Again, my name is Pramil. I'm a program director, internal medicine residency, transitional residency, and I teach medical students and residents. And let's get into our subject. So, talking about erectile dysfunction briefly is increasingly becoming common and common. Okay, if you're older than 20, there's like almost like 20% chance you can have like erectile dysfunction. As we age, it increases more. So a big problem in the United States. So what is the mechanism for erection? You got arousal, you got parasympathetic signal to penis, release of nitric oxide. And that kind of convert GTP into CGMB, and CGMB make the smooth muscle relaxation, then you get the erection. Okay. Now, if you look at the bottom of the slide, you can see that CGMP is broken down to 5GMB. That's where the Viagra work. Viagra blocks that breaking point, and the increased CGMP, there's going to be erection. So that's where Viagra works. Risk factors could be many. Age is one of the most common. Medical condition like diabetes, hypertension, any of the many medical conditions, smoking, obesity, certain medical treatment, injuries, medication, drug and alcohol use. Okay. Now, what is physical activity? How does it help? Okay. Studies have shown that when you increase in the nitric oxide phosphorylation, that is a molecular mechanism when you do like a lot of exercise, especially the aerobic exercise, mild to moderate. So the shear stress stimulates the endothelium-dependent production of reactive oxygen species. This reactive oxygen species at low concentration function as a signaling molecule, diffuse through the vascular wall and increase the nitric oxide. So main thing you need to know to pick up this exercise, increase the nitric oxide, which in turn converts it into CGMP, and then you can have like smooth muscle relaxation, and then you can have erection. Okay. So when we look at it, the first, how do you assess or how do you diagnose? You got this nice international index of erectile function, 5 score, and you ask the patient the questions and you come with a score. If the score is like around 22 to 25%, no erectile dysfunction. If it is 5 to 7 point, there's severe erectile dysfunction. So next thing we have to do, we did this literature survey, we found this great journal, British BMJ found this article, Physical Activity and Exercise and Erectile Dysfunction, and systematic review and meta-analysis. So then we looked at their objective. Their objective was to look at investigate the benefit of physical activity and exercise in treating erectile dysfunction. Okay. Again, design is a meta-analysis, so one of the best strength in the evidence-based medicine meta-analysis, pulling a lot of studies together, and you look at the main thing when you have meta-analysis, you look at the forest plot, you look at the diamond, and look at the line in the middle is all the way on the right side. Very significant, my friends. So conclusion, based on this meta-analysis, physical exercise, activity, and exercise are effective intervention to treat erectile dysfunction. We talk about the role, the pathophysiology is the nitric oxide production, and also the pelvic floor muscle exercise also helps. Thank you so much for watching. We'll be back with another presentation soon. Thank you.